Are there any relevant lessons to be found in the strategies developed to overcome barriers to HIV testing and treatment that may be applicable to overcoming barriers to HCV testing and treatment today?
Well, I think we can learn a lot from the U.S. and international public health approach to HIV. If we look at hepatitis C, there's a couple of features. Well, one, it's common. It impacts more Americans than HIV by about a fourfold a higher prevalence rate, yet it is a very silent disease. People don't really talk about it. They haven't talked about it. It's not something that's been in the public eye for some time. And in part, that was because treatments weren't very good, in part perhaps because it's been linked to injection drug use, and there hasn't been an advocacy. So what we're now seeing and beginning to borrow, if you will, from the HIV approach when that disease presented in the 80s is this idea of public discussion that's led by the CDC and new recommendations to screen baby boomers. So going out and finding people are infected, but it's also being pushed by better treatments. When there's a treatment that's very good, the idea of allowing someone to remain undiagnosed becomes extraordinarily problematic. So there's now a conversation, and I can tell you that many of my patients are relieved that we're now, as a society, talking about hepatitis C. It's freeing to them in terms of the stigma. So it's going to take efforts from the Public Health Forum on diagnosis and screening, really getting hepatitis C out of the shadows. And we are seeing that with advertisements on television and advertisements by the CDC and airports and places like that. The next steps, though, are really going to be a commitment to do something about the disease. And we're having this discussion in early 2014 about cost. How will we cover the cost of treatment for nearly 3 million Americans? Who needs treatment? How do we approach this? Well, it's not that dissimilar to the conversations with HIV. And there was ultimately a federal and state-driven approach to this issue of who pays for antiretroviral drugs. My hunch is we're going to need to see that same type of commitment to eradicate hepatitis C if we're going to make a difference. Now, that hasn't happened quite yet, but we're having that conversation. So the roadmap is there, we just need to follow it, and sometimes that's more difficult to do than it is to lay out the roadmap.